Good morning, doctors. Welcome again. Today we are going to discuss about OBS and gyne MCQs for neet PG, plab, usmle and mrcp MCQs part 2nd. 23-year-old woman being followed up 6 weeks after surgical procedure to evacuate the uterus. Following a miscarriage, the histology has shown changes consistent with hydatiform mole. What is single most appropriate investigation in this case? In this case, we need to do beta HCG. Let's discuss. Serum beta HCG. When your first diagnosis hydatiform mole, HCG level will be raised. When hydatiform mole treated removed, HCG level usually returns to normal, non-pregnant amount and should remain so. If you developed gestational trophoblast neoplasia, the HCG remain elevated, continue rise further. So this blood test is good way to check the possible development of gestational trophoblastic neoplasia. So guys, I hope it's clear till now here. Okay, let's move on another MCQ. Let's discuss. 28-year-old woman has admitted at 38 weeks gestation. Blood pressure 190 by 120 high and proteinuria 3+. Immediately following admission, she has grand mal seizure. What is single most appropriate initial management? Firstly, you have to understand this is a case of eclampsia. And the treatment here is by magnesium sulfate IV magnesium sulfate. Let's discuss. Magnesium sulfate IV, patient has established eclampsia, which I told. 4 mg magnesium sulfate, 100 ml 0.9 saline IV within over 5 minutes. Then maintenance is IV infusion 1 gram per hour for 24 hours. Beware depressed respiration. If recurrent seizures, 2 gram IV magnesium sulfate over 5 minutes. Tendon reflexes and respiratory rate every 15 minutes. IV magnesium sulfate if respiratory rate stop. Magnesium sulfate if respiratory rate below 14 or tendon reflexes or urine output less than 20 ml per hour. Okay, let's discuss more. 27-year-old woman had pre-eclampsia and was delivered cesarean section. She is now complaining of right upper quadrant pain, different from the wound pain. Initial investigation you do immediately, that is LFT, liver function test. Why? Because you are suspecting the case of HELLP syndrome. Let's discuss. LFT in post-cesarean patient having pre-eclampsia, right upper quadrant pain, different from the wound, towards the diagnosis of HELLP syndrome. So immediate investigation to be done is LFT. Okay. A 34-year-old female present with foul smelling. What set of organism we are looking to be treated here? So this is a case of Gardnerella vaginalis. Okay, this is case of Gardnerella vaginalis alone. Let's discuss. So Gardnerella. Here the foul smelling discharge caused by Gardnerella. So acceptable answer here is E. Gardnerella only. Okay. 39-year-old woman, tubal sterilization, and she wants to know the failure rate of this type of sterilization. So failure rate of this type of sterilization is by 1:200. 1:200. Okay. Now. So hope it's visible. Now, patient with previous history of the membrane ruptured and the cervix 3 cm dilated 4 hours. Later on examination showed that the cervix was still 3 cm dilated 4 hours later. Also 3 cm dilated. What is the single most appropriate management for her? So give her IV syntocin drip. It's oxytocin drip Syntocin drip, yeah. This is no progress of labor in 4 hours, hence syntocin drip should be given. Okay. 27-year-old waitress has pelvic pain, dysmenorrhea, and increasingly heavy periods. She also complains of dyspareunia. There is generalized pelvic tenderness without peritonism. The pelvic US is normal. What is most likely diagnosis? So this is a case of pelvic congestion syndrome. Okay. Yeah. Sorry. Sorry guys. Pelvic congestion syndrome. Let's discuss. In pelvic congestion syndrome, there is develop of varicose vein in lower abdomen and prolonged standing. Occurs in a waitress who remains standing for long with some pain syndrome like pelvic pain, dysmenorrhea, dyspareunia, generalized pelvic tenderness without peritonism. Also, they may be associated with menorrhagia. Okay. 14-year-old girl is clinically obese. She has not started her periods yet and has severe acne. Among her investigation, high insulin level is found. What is the most probable diagnosis? So this is a case of PCOS, polycystic ovarian syndrome. Let's discuss. It is not Cushing, as insulin level in Cushing are not usually raised. Here obesity is primary, amenorrhea, acne, and particular high level of insulin make like diagnosis of PCOS. Okay. That 18-year-old girl with primary amenorrhea complains of severe abdominal pain every 4-8 weeks, which is now getting worse. Exam, lower abdominal mass is felt. What is most likely diagnosis? So here is a case of hematometrium. Let's discuss. Primary amenorrhea and periods pain indicates hematometrium, either secondary to imperforate hymen or vaginal septum. Okay. 32-year-old woman, parity 3, 39 weeks gestation, reports having a spontaneous roam 4 days ago. She didn't attend the delivery shoot as she know what would happen, had already decided on a home birth. Today she feels very hot and sweaty, although that she was starting to have labor pain, but she describes the pain as more constant. Exam, uterus is tender throughout. Blood test shows raised CRP and WBC. Select the most likely diagnosis. So the diagnosis here is chorioamnionitis. Let's discuss. Prolonged rupture of membrane can lead to chorioamnionitis. Okay. 42-year-old overweight smoker comes with heavy periods. A scan reveals a normal uterus. She would like a long-term treatment with minimal side effects. What would offer treatment for the menorrhagia and provide contraceptions? She is unsure whether she would like more children. She is adamant that she doesn't want surgery as she is terrified of the prospect. Select the best management for her menorrhagia. So we can give her here intrauterine systemic progesterone because COCP is contraindicated in smokers. And yeah, IU intrasystemic progesterone. As a patient is a smoker, COCP should be avoided in given case. Option C, Marina, we can say is the most suitable. Okay. Now, you are called to see 20-year-old woman 2 hours post LSCS. She has not passed urine since her operation. She denied any urinary symptoms preoperatively. Exams appear unwell. Temperature 37.5 degrees Celsius. Blood pressure 94 points by 73. Pulse 116. Saturation 97%. Her abdomen is distended with tenderness in the left flank and suprapubic region. Bowel sounds are not audible. Choose the most appropriate cesarean complication for this lady is. This is a case of urinary tract injury. Urinary tract injury. Okay, yeah. Now, 40-year-old teetotaler woman is recovering from hysterectomy. 2 days ago at night, she becomes agitated and complains of seeing animals and children walking around the ward. What is the most likely diagnosis? So, here is a case of toxic confusional state. This is a case of toxic confusional state. Okay. This is not delirium tremens as woman is teetotaler. Okay. 28-year-old woman who is 32 weeks pregnant in the third pregnancy is diagnosed a case of placental abruption. After all effective measures, she is still bleeding. What is underlying pathology? So, here is a clotting factor problem. Okay. Yeah. Now, 28-year-old lady presents with severe lower abdominal pain with excessive vaginal with bleeding, 34 weeks gestation. What should be initial investigation of choice? Excessive vaginal bleeding. So go for here US abdomen sonography or abdomen. Okay. Likely the case of abruption placenta as excessive bleeding, probably rival type, of which initial investigation of choice is USG abdomen. Other features that will favor abruption is hard uterus and evidence of fetal distress. It will difficult to feel the fetal parts. Okay. Now, 33-year-old female presents with sudden severe colicky abdominal pain in right inguinal fossa. A mobile mass is felt on examination. What is most likely diagnosis? So this is a case of ovarian torsion because here is no history of pregnancy also. That's why ovarian torsion. A 35-year-old primigravida post-cesarean section complains of inability to void. She denies dysuria but complaints of fullness. She was treated with epidural or analgesia. The single most appropriate investigation here is go for USG abdomen. Let's discuss. USG abdomen and USG KUB is also correct. This is a case of post-operative urinary retention. We should do us to know the urinary volume, urine volume in bladder. If less than 400 ml, we should observe. When volume is more than 600 ml, we should do catheterization. Okay. Now, 53-year-old lady present with hot flushes and night sweats. Her LMP was last year. She had MI recently. What is most appropriate management for her? So the most management best here is for clonidine. We give her clonidine. Okay. COCP is a wrong key. Correct key is clonidine. COC is absolutely contraindicated in MI patients. Okay. Let's discuss. A young girl present with OBS gyne assessment unit with lower abdominal pain and pervaginal bleeding after her hysterosalpingography. as a part of her infertility treatment. Observation: blood pressure 90/50, pulse 120, exam reveal rigid abdomen. What is most next investigation? So this is a case we do here USG abdomen because this is a case of ruptured fallopian tube. Yeah, USG abdomen likely cause of bleeding shock is ruptured fallopian tube. For repeat appropriate next investigation is sonography. Okay. 21-year-old woman who is on COCP had to take azithromycin. What should you advise her? Azithromycin no effect on COCP, so advise her to continue COCP. Okay, let's discuss. Yeah, no extra precautions. Before it was thought that antibiotics like azithromycin inhibits the enzyme and reduces efficacy of COCP, but later it was established that practically no significant changes occur and so no need of any extra precautions. Okay, let's discuss. Pregnant lady had her antenatal screening for HIV and hepatitis B. What more antenatal infection should be screened for? We go for rubella and syphilis. So in pregnancy we do VDRL also. Okay, yeah. 26-year-old lady with abdominal pain, vaginal discharge, low-grade fever. What is most likely diagnosis? This is a case of acute PID. Yeah. Now, 26-year-old lady with high fever, lower abdominal pain, purulent vaginal discharge. She looks very unwell. What is the most appropriate management for her? In this case, we give ceftriaxone 2 grams and doxycycline 100 mg. Okay. Yeah. Ceftriaxone 2 grams, doxycycline 100 mg. The disease is severe, needing inpatient management. Ceftriaxone 2 gram, IV doxycycline 100 mg. Okay. 39 weeks pregnant woman come to labor suit 3 days after an obstructed labor. Present with pain and swelling of one leg. Exam leg has blue mottling and is cloud. What is the diagnosis? Diagnosis here is embolus. This is a case of embolus. Okay. 8 weeks pregnant woman present with persistent vomiting and weight loss. Heart rate 110 beats per minute. Dehydration was corrected with normal saline infusion and potassium. The condition didn't improve, so IM cyclazine was given. She is still vomiting. The next appropriate management here is IV steroids. Okay. IV steroids may be used in patient hyperemesis gravidarum refractory to secondary therapy. Okay. Yeah. 28-year-old lady present with dysmenorrhea. She is very obese. She now wants reversible contraceptive methods. What is the most suitable method here? So this you're going to use Marina. Yeah. No, POP is recommended. Marina can be used, but if POP in options, so go for POPs. Okay. A lady who is 28 weeks pregnant, present with vaginal bleeding. She's lost about 200 ml of blood. Exam uterus is tender. Resuscitation has been done. What is important investigation to establish the diagnosis? So go for sonography, ultrasonography. Antepartum hemorrhage, most important investigation to establish the diagnosis is ultrasonography. Okay. Yeah. 32-year-old woman wants reversible form of contraception. She has one child delivered by emergency cesarean section. She also suffers from migraine and heavy periods. What is the most suitable form of contraception for this lady is mini pill. Mini pill, yeah. Mini pill, okay. IUCD is wrong, so mini pill is the answer, okay. 27-year-old lady after cesarean section develop epigastric pain after 8 hours. What is the appropriate investigation? Go for liver enzymes, LFT. Epigastric pain is a warning sign of HELLP syndrome, so rule out HELLP syndrome. Liver enzyme should be done, okay. 8 weeks pregnant lady brought to the ED due to severe vomiting. She was administering IV fluids, oral IV antiemetic. She still can't tolerate anything orally. What is next best treatment? Give her IV antiemetics. Give her IV antiemetics. Yeah. If oral antiemetics are not tolerated, give IV antiemetics. Okay. Patient comes with dyskaryosis to the OPD. She is heavy smoker and alcoholic. Cervical smear shows abnormal cells. What is the best advice for her? She has to do colposcopy here. Colposcopy is recommended here. Okay. A lady came for OBS gyne assessment unit with history of 8 weeks pregnancy and bleeding per vagina for the last 2 days. On bimanual exam, uterus 8 weeks in size. On a speculum exam, cervical osseous closed. How do you confirm the viability of the fetus? That is mainly confirmed by transvaginal ultrasonography. Okay. Viability of fetus is better assessed with sonography. TVU can be done throughout the pregnancy. If should be avoided once the membrane is ruptured or to avoidance chance of fetal infection. Okay. 21-year-old female in her first pregnancy at 38 weeks was brought to the ED with generalized tonic-clonic seizures. If magnesium sulfate, IV magnesium sulfate was given but feeds was not controlled, she is having feeds again. What is the single most important immediate management of this patient? Give her bolus magnesium sulfate. Okay. Yeah. IV magnesium sulfate wrong. Give magnesium sulfate bolus. Treatment of first seizures with 4 grams magnesium sulfate in 100 ml 0.9% saline IV. Over 5 minutes maintenance IV infusion 1 gram per hour for 24 hours. Beware of respiration. If recurrent seizures, give 2 grams IV magnesium sulfate over 5 minutes. Check tendon reflex and respiratory rate every 15 minutes. Stop magnesium IV infusion if respiratory rate below 14 or tendon reflex. Loss of urine output less than 20 ml per hour. Have IV calcium gluconate ready in case of magnesium toxicity. IV 1 gram 10 ml over 10 minutes if respiratory depression. Use diazepam once feeds continue. Example 5-10 mg slowly IV infusion. If seizures continue, ventilator and consider other causes. Consider CT scan, OSCS. 24-year-old lady with BMI 30 complains of facial hair growth, history of amenorrhea, FSS 10.9, prolactin 400, estradiol 177, progesterone normal, LH 33. What is most probable diagnosis? This is a case of PCOS. Yeah. Lady comes with missed IUCD triad. Her LMP last menstrual period was 2 weeks ago. What is single most appropriate next step in management. So here we are, next step management is vaginal exam. Yeah. US abdominal is wrong. Correct key is vaginal exam. Lost thread. First confirm the thread is not in a position by vaginal examination. If not present, ultrasound should be arranged to locate the device. If ultrasound does not locate the device and there is no definite history of expulsion, then abdominal X-ray should be performed to look for an extrauterine device. Expulsion should not otherwise be assumed. Hysteroscopy can be helpful if ultrasound is equivocal. Surgical retrieval of an extrauterine device is advised. Okay. 32-year-old woman presents with a history of lower abdominal pain, vaginal discharge. She had her menses 4 weeks ago. She has a temperature 38.6 degrees Celsius. Most suitable diagnosis here is, so this is a case of acute PID. Acute PID. Yeah. No, this is case of ectopic pregnancy. No, acute PID is the right answer. Yeah. 40-year-old female was on COCP, which she stopped 6 months ago, but she has not had her period since the labs FSH 22, LH 24, prolactin 700, estradiol 80. What is single most appropriate diagnosis? So this is a case of hypothalamic amenorrhea. No. Premature ovarian failure. Let's see. FSH LH raised, so this is ovarian failure. FSH more than 20, woman aged is around 40. Secondary amenorrhea indicates ovarian failure. Okay. When FSH LH raised, that is premature ovarian failure. 25-year-old woman present with single lump in a breast and axilla. The lump is mobile and hard. Consistency, the sonography, mammography and FNA turned out to be normal. What is most likely appropriate investigation to confirm the diagnosis is by core biopsy. The lump is suspicious, but sonography, mammography and FNA turn out to be normal. So most appropriate investigation to confirm the diagnosis is by core biopsy. It is often the preferred biopsy method because it is accurate and does not involve surgery. Okay. 37-year-old lady stopped taking COCP 18 months ago and she had amenorrhea 12 months duration. FSH 8, LH 7, prolactin 400, estradiol 500. What is the cause? The cause here is post-pill amenorrhea. Post-pill amenorrhea, failure to resume menses within 6 months of stopping pills, was amenorrheic for 12 months. Okay. Patient with mild dyskaryosis 1 year ago, smear was normal. What is most appropriate next step? So next step here is colposcopy with mild dyskaryosis. Colposcopy should be done with HPV test. An African lady presents with heavy but regular periods. Her uterine size correlates to 14 weeks pregnancy. What is most appropriate diagnosis? So this is the case of fibroids. Regular heavy menstruation in a uterus of 14 weeks. Size is highly suggestive of fibroids. Okay. 29-year-old at 38 weeks gestation age. Present with 2-hour history of constant abdominal pain. She then passes 100 ml of blood per vagina. What is next appropriate investigation? So the next appropriate investigation here is do USG is wrong, CTG we have to do here. Okay. 26-year-old woman had amenorrhea for 10 weeks and is pregnant. She experiences hyperemesis. Now she presents with vaginal bleed. Exam uterus 16 weeks. Os closed. What is most probable diagnosis? So this is a case of molar pregnancy. This is case of molar pregnancy. Yeah. Molar pregnancy in hydatiform mole, uterus becomes more size than actual gestational age, and due to production of large amount of gonadotrophin by moles, patient suffers from severe vomiting, example hyperemesis. There also occurs vaginal bleeding. A pregnant woman of gestation gravida 2, gestation age 11 weeks, present with heavy vomiting, headache and reduced urine output. Urine analysis shows ketonuria. Choose the next best step. So the next best step here is we have to give IV fluids. Hyperemesis gravidum with oliguria and ketonuria, IV fluid should be started to prevent renal failure. A patient had inflammatory changes on cervical smear. There is no vaginal discharge, no pelvic pain, and no fever. What is next step? Inflammatory changes, cervical smear, no vaginal discharge, no pelvic pain, no fever. So repeat smear in 6 months. Take swab, this is wrong. Right is repeat smear in 6 months. Okay. 37-year-old infertile lady with 5 centimeters subserosal and 3 centimeters submucosal fibroid is trying to get pregnant. What is most suitable option? So we go and do here myomectomy. That is myomectomy. Yeah. Fibroids are preventing from her being pregnant. So myomectomy is the most suitable option to let her get pregnant. A woman who is on regular COCP presented to you, advise what to do. She has to course of 7 days antibiotic. What you would advise? Continue regular COC. Yeah. Continue COCP and backup contraception using condoms 2 weeks is a wrong key. Correct should be the continue regular COCP. Before it was thought that the antibiotics after the gut flora and ethinyl estradiol is not conjugated. There is more ethinyl estradiol passes in the stool, so pregnancy and breakthrough bleeding can occur. But later it was established that except for strong enzyme inducer like rifampicin, rifabutin, other antibiotics particularly does not reduce potency of COCP. And hence except only rifampicin or rifabutin or for other antibiotics no additional precautions are needed. Okay. Lady present with hot flushes and other symptoms of menopause. What is treatment option? Give her HRT, hormone replacement therapy. 28-year-old woman at 34 weeks gestation age for her first pregnancy attends antenatal clinic. Her blood results hemoglobin 10.6, MCV 95, MCS 350. What you do for her? So explain this is physiological hemodynamic anemia. Okay, according to NICE guideline. Okay, so guys, I hope till here it's very much clear for you. If you have any queries, any question, you can ask me. If you're new on my channel, please subscribe it, and if you like this video, put like on it. Thank you. Good day. Goodbye. That's all.